So, this is my medical assessment. I have a 50-year-old female complaining of chest pain and shortness of breath. I have my PPE on, seen as safe. Number of patients is 1. Nature of illness would be the chest pain and shortness of breath. I would call for additional resources such as ALS. And I would consider C-spine, but with what I have been presented so far, it does not appear that I need it. General impression when I walk in the room, she seems to track me with her eyes. She answers my questions, which puts her as alert. She does seem to have a difficulty breathing with her tripod position. And her chief complaint is shortness of breath and chest pain. So, hi ma'am. My name is Michaela, and I'm an EMT. What seems to be the matter today? And she will tell me that she was on the treadmill about 30 minutes ago. She started having really bad chest pain, so she stopped. She sat down. Her pain has gone down a little bit, but not by much. Then she started having difficulty breathing after the chest pain. So her airway seems to be clear because she is talking to me. She does seem to have a difficulty breathing, so I would put her on a non-rebreather mask at 15 liters of oxygen to help with that. And her circulation, I would check her pulses. And they seem to be there, but they're a little weak. She seems pale and diaphoretic. And then I would make her a priority patient and transport her right away. I would start my history taking. So when did this happen? It happened 30 minutes ago when I was on the treadmill. Does anything make the pain better or worse? She states that by sitting down it makes it a little better. If you could rate your pain from 1 to 10, 1 being the no pain and 10 being the worst pain you've had in your life, what would you say? She told me it is about an 8. Does the pain go anywhere? Where does the pain start? And she tells me it starts in her chest. She says that it does radiate from her left arm up to her jaw. Can you describe the pain for me? She says that it feels like there's an elephant sitting on her chest. And then, just to clarify, this happened about 30 minutes ago at about 1 o'clock when you were on the treadmill. And she does confirm that is when it happened. Past medical histories, do you have any allergies to anything? She says no. Do you take any medications? And she tells me no. But later when I look, she has a bunch of medications in the bathroom. What is your past medical history? She says she has a heart problem. That happened a couple years ago. She went to the hospital for it. And the doctor said that she did, in fact, have a heart attack. They put a stent in, and she hasn't had issues since then. When was the last time you ate? She said she had some toast with eggs this morning at about 9 o'clock. And what led up to this event? Did you have any pain before you started running on the treadmill? She states that she felt fine this morning before she started running, and after about 10-15 minutes of running, she felt the chest pain and felt a little weird. So this would be a cardiovascular problem, and I would want to check lung sounds. Her lungs seem to be clear. It seems that the oxygen has helped her breathing. I would also want to take her blood pressure. Her blood pressure is a little high at 130 over 100. I would also want to check her oxygen levels to see if those are doing okay. I would also check her respiratory rate and quality. Since given the oxygen, it seems that her respiratory rate has slowed down, and the quality seems to be a lot better with the help of the oxygen. And as I transport her, I would reassess her every 5 minutes. I'd be checking that she's still, that her breathing is still okay with the oxygen, and I would make sure that there's no other issues with her heart as well as we transport her to the hospital.